Hi. I'm here to talk to you about everything you need to know about hernia. Hernia is an abnormal protrusion of internal organs through an abnormal opening in the wall of the cavity. A combination of increased pressure inside the body with weakness in the wall is responsible for this condition. In this condition, internal organs or parts of organs are protruded out, forming a swelling which will increase the size with coughing and lifting weight, and while passing stool and urine. In lying down position, the swelling goes inside except in strangulated and irreducible hernia. Causes: 1. Weakness in the body wall. A. Congenital weakness. Congenital weakness, acquired weakness due to injuries, wasting of muscles, suppurative lesions in the wall and presence of weak natural openings, obesity, lack of exercise, repeated pregnancy. C. Surgical operation with improper suturing or sepsis of operated site. 2. Increased pressure inside the body. Chronic constipation. Recurrent cough. Weightlifting. Stricture of urethra. Hernia can occur anywhere in the body. However, there are some common sites for hernia. The common site for hernia is abdominal wall. Compared to other parts, the abdominal wall is weak due to the presence of some natural orifices. There are some areas wherein the abdominal muscles are weaker and thin, and all these factors make a chance for herniation. Later, the large portion of intestine may come out which may not go back easily. Femoral hernia. This type of hernia is more in females. Here the abdominal contents pass through the femoral canal, which is seen just below the junction between the thigh and lower abdominal wall. This type of hernia is more in females. Here the abdominal contents pass through the femoral canal, which is seen just below the junction between the thigh and lower abdominal wall. The contents pass downwards and comes out through saphenous opening in the thigh and forms a swelling under the skin. C. Umbilical hernia. Umbilical hernia. This is common in children. The umbilicus is the weaker part of the abdomen. D. Incisional hernia. Epigastric hernia. Here the herniation occurs in the epigastrium. F. Lumbar hernia. Obturator hernia. This is a rare type of hernia. Here the contents pass through obturator foramen in the pelvic bone. Complications of hernia include: 1. Strangulation. Intestinal obstruction. This occurs when the whole portion of the intestine is protruded into the hernial sac. The narrow hernial orifice will block the passage of bowels. Infection and peritonitis. If there is strangulation with death of a portion of intestine, there will be spread of infection to the abdomen, resulting in peritonitis. Treatments of hernia include: 1. Use of hernia belt. Treatment of constipation, recurrent cough, urinary obstruction. Fat reduction will increase the strength of abdominal wall. 4. Abdominal exercises to increase the muscle tone. 5. Take plenty of leafy vegetables, fruit and fibrous diet for easy bowel movements. 6. Try other systems like homeopathy, herbal medicine, etc. If no relief by the above steps, consult a general surgeon for surgical management. Surgical treatments include herniatomy. In this operation, the contents of hernial sac is pushed into the abdomen, the neck of the sac is ligated with transfixion ligature, and the sac is cut off. Herniorrhaphy. Here, along with herniatomy, the posterior wall is repaired. Hernioplasty. This operation is done if herniotomy is not possible due to wide neck of the sac. Here the repair is done with the help of non-absorbable materials like tantalum gauze, polypropylene mesh or stainless steel mesh. Hope you found it useful. For more information please click the link in description.